Check patient ID. Check for allergies. Hygiene of your hands. Those are standard nursing care, things that you should never, ever forget. The other standard nursing is body mechanics. Got it? So what are they?
Check doctor's orders.
Hand hygiene, allergies, body mechanics. Okay, and then check patient's ID. Okay, you must always check the patient's ID. Things that have in common, anytime that you are going to deal with a painful procedure, you're going to have to ask your patient for pain. What is your pain scale? 5. Okay? You need to then, with that number, you need to go to the doctors or to the MAR and check and see when was the last time this patient was medicated. Because ideally, you want to do how many minutes before or after the pain medication is administered? 30. So if it hasn't been with that time, you need to reassess the situation. All right, so now that you have that, you checked everything. You checked the type of dressing change that your doctor wants you to do, because there are numerous dressings changed. Our order is a post-surgical dressing change, and it needs to be sterile. With this sterile procedure, now we know that every supply we bring must be sterile, and that could include sterile gloves. Now your bag supplies you with one of these kits, but not a lot of facilities have this fancy thing. But if you're doing a dressing change, what will you need? Gauze, sterile gloves, something to clean the wound with. If your patient is allergic to iodine, or a lot of surgeons don't want you to use iodine, then you bring your sterile water, sterile normal saline. Really, that's what they would prefer for you to do. We have a nice kit. You walk in the room with your supplies. This is really all I need, and I need clean gloves. Good morning. What should we, Miss Halloween? How are you this morning? Introduce yourself. That's another nursing standard care. Introduce yourself. To find out where the dressing is. It happens to be in the abdomen because you already read the orders, right? That this was an abdominal surgery. With that abdominal surgery, remember, you cannot change that dressing within 24 hours. It has to be 24 hours. The surgeon sometimes likes to do the first one, but if you do have orders to do that, provide what? Privacy to the patient. The patient doesn't want to see often, their wound. If they have drains, then we need to assess the drains. Our patient doesn't have any drains right now, so uncover this in a way that is going to be comfortable. You could do that, you can start putting your gloves on. The rule of the thumb is once you wash your hands, always put your gloves on, your clean gloves. Okay, so with these clean gloves, expose your patient, check what your dressing is. This is sterile, so it should be at waist, but I don't have that luxury right now. So I am going to open this, remember, away from me. Try not to talk over it. First thing up here is going to be your trash bag. This is red, considered biohazard, but a lot of facilities, it's not really biohazard unless it has a bacteria that is going to be, pose a threat of infection to the rest of the floor. So you can put this, tape it on the side of the table. You can put it on the bed, but if you do, away from the face, away from the hands, really far away from what that is. Always just, yes.
Is that a sterile container though?
That is a sterile container. Okay. But I don't have a table.
Oh, okay.
But you're right. You should put this, your table, if you're right-handed, where should your sterile field be?
Next to you.
Right next to me, right? So let's say that this is going to be my table, just so that we can have a little more realistic prop.
Can you open that with clean gloves though?
Yes.
They don't
You're
have to be
opening
sterile?
No.
And you grab
because
this?
Oh yeah, because you're
dirty. The only thing that is sterile in here is where? In here.
So it's okay to grab the trash
It's okay to grab it, like with your fingers, okay? All right, so you have that right next to you. Don't give it your back. So do not give it your back. You're going to kind of place yourself in this direction. Next is remove the dressing. Which direction?
Towards the...
So gently you are going to remove that. Don't press because this is very sensitive. Just very lightly. Remove. Assess. What kind of drainage do you have? Is it sanguineous, serosanguineous, or
Serous.
purulent? Okay. So now you assess that. Is there any odor? If there's a foul odor, it means infection. Okay. I'm not asking you to go like this. Okay. But if it's a foul odor, you are going to smell it. Fold it. Put it away. Assess. What am I assessing for? Infection. What are the cardinal signs of infection? Redness.
Inflammation.
So now tell me the medical terms for this. Erythema.
Edema.
Purulent exudate. And possibly warm. We can't really test it right now because this is, it's considered sterile. All right, so now also count how many staples you have. Always. It should say in the file somewhere how many staples there are. So count the number of staples. And 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 23, 25. Okay. Remove your gloves. Sanitize your hands, right? Okay. Can somebody look in that bag and see if there's sterile gloves? Because this doesn't have sterile gloves in it. Yeah, that'll work. Okay. Now there's two ways of doing this. This is the easiest way for you new as a student. All right? Grab this from here. Oh, she doesn't have her gloves on. It's okay. Because this blue part is going to touch this. So you're good. Don't be afraid of it. Away from you. Not enough room on the table? Well, guess what? Just fold it in half. You don't need all of that space. Okay? You see how I am touching just the corners? Which side is sterile now? They're both sterile.
They're both sterile.
So just pick it up with your hand and gently lay it there. Okay? Next thing is I'm going to do the dumping, so what I call the dumping system. Just grab this, hold it from the side, and just gently. Is still sterile?
Mm-hmm.
Yeah. Okay. Do I need this? Not right now, but if I did need to use saline, I could put my saline in here. Okay? So let's say that I did. So I'm just going to put it here. I have my saline, and I pour it in. What's next? My gloves, right? But now I have no room on the table. Grab from over here. And this really is a lot smaller than your other one. It's not uncommon that nurses will use a little bit of the side of the bed. If you have a table like over there, everything can fit in it. You know what, actually, bring me one of those. Bring me the actual table. I want you to see how it can be set up.
They already have one.
Oh. And if you remove this for me, so you can just... Okay. Alright, so now I am with her. You see how when you fold it in half, you have lots of room there. Open up your gloves. Which glove do you put on?
Dominant.
Does it matter?
None.
Dominant.
Okay, just put the one that you picked up first and make sure you don't contaminate it. That is the primary thing to do. Put your other one on. The way to not, these fingers as a student, I see it over and over. You do this and you don't even know it. Fingers up. That way you don't run the risk of contaminating. Okay? I don't need this, so this can go in my trash. I want this a little closer to me. Can I do this?
Yeah.
Absolutely. What if this is in the way? And I have both of these.
Inside.
Okay? How am I going to use these? Well, start organizing it in that way that you're going to use it, just like you did with your other procedure. Okay. What are these for?
To use for the dressing.
This is for debridement. Is this a debris?
No.
No. What is this for?
Their tongues.
They're your gauze.
You could use it for grabbing that, but if you already are clumsy, why would you want to do this? Use it. You don't have to use these. That's what I'm trying to say. Okay? So you could leave it here just in case. What is that safety pin for? For when you have a pen rose. If you have a pen rose strain, it's always held in place with a safety pin. So we change the safety pin. So we really don't need it. We have our tape, we have scissors. Sometimes we have to do debridement, or maybe a suture is really irritating, it's too long, and we can just cut it a little bit. And then you have your iodine. All right, so let's say that I open these up. I finished. There was one more thing I needed to do for my assessment, right? And that was, I want to feel if it's warm. Because if it's warmer than the other, it tells me that maybe an infection is starting to brew in there.
But now your hand is contaminated already, right?
No, because this is sterile. Anything under the dressing is sterile. Okay. So now the next thing that you're going to do is grab your, right, these guys here, and you're going to start from the middle, right? 1, 2, 3.
With your gauze, right?
With these. These are swabs.
Oh, okay.
Let me open these just so that you can see what these look like. But don't open them, okay, and use them. This is what they look like. Okay, there are 3. So 1, trash. 2, trash. Take the third one. Don't cross over. Go around. 3. Because what you want to do is push the bacteria away. Okay, that's done. Air dry. Never. Okay, just air dry. The next thing is if the wound previously had these on, let's say it's dry, you just put it on. And we put this. Why the blue line up? It's just like a diaper. When it's saturated, it's starting to disappear. Okay? So should I put it this way or this way? Following the wound. Okay. That's all I need to do. My next thing is now to tape, right? Do you see how easy that was? It really is all about how you set yourself to succeed. So the trick is organize yourself. We're going to pretend that there aren't any staples here, okay? And then just continue with all the way around. Time it, date it, initial it. How can you do that? The easiest way to do is take your gloves off, take a little piece of tape, I don't know where my pen went. Anyway, so just tie, thank you.
Blue though.
It's okay. Today is the 31st, 2011, 2 p.m., so 1400.